Good afternoon, ladies and gentlemen, and welcome to the American Enterprise Institute. I'm Arthur Brooks. I'm president of AEI, and I'm honored and delighted to welcome you to today's important event featuring Speaker of the House Paul Ryan, Congressman Steve Scalise, the Majority Whip of the House, Congressman Kevin Brady, who's the chairman of the Ways and Means Committee, Congressman John Klein, who's the chairman of the Education and Workforce Committee, Congressman Tom Price, who's the chairman of the Budget Committee, and Congressman Fred Upton, the chairman of the Energy and Commerce Committee. Now, you might ask why we have such a high concentration of distinguished members of Congress here, the Speaker and the Whip and committee chairman, et cetera. The answer to that question is that we're going to explain a new and important plan to reform and modernize our health care system. If that's the event that you intended to come to, you're in the right place. The plan presented here today is the product of the work by the Speaker's Task Force on Health Care Reform. I'm looking forward to a very substantive discussion. Speaker Ryan will begin our discussion and then turn it over to Majority Whip Scalise, and then AEI's own Jim Capretta is going to moderate a discussion amongst the four chairmen who produced this plan and open it up for questions from the audience. So with that, let me turn it over to my friend, Speaker Paul Ryan.
Thank you so much, Arthur. I just can't tell you how thankful we are for your leadership and for the American Enterprise Institute. It's probably going to be my last time in this room. Look forward to seeing your new digs down the street. So let me just cut to the chase. For 6 years now, 6 years, we've promised to repeal and replace Obamacare and make health care actually affordable. Well, here it is. A real plan in black and white right here. We are officially putting it on the table. The way I see it, if we don't like the direction the country is going, and we don't, then we have an obligation, a duty to offer an alternative. It is our duty to offer a better way. And that's what this is. I'm going to let our chairman talk more about the details. They have done tremendous work. This is the result of a bottom-up, inclusive process by all House Republicans working with constituents and concerned individuals to come up with a better way to have a healthcare system in America that we can be proud of. But I thought I'd kick things off by summing up the big difference between Obamacare and our plan, because in all honesty, it is more than really just a difference in policy. It's a difference in philosophy. If I had to pick one word to me that summed up Obamacare, it would be quantity. The goal was to get as many people insured as possible, or at least that's what they now say the goal was. They promised a whole lot more at the time when they passed it. The one thing that they've decided to hang their head on is this: more people have insurance now than before when the law was passed. That's true. Here's the problem. They expanded coverage by dramatically lowering quality. They made some people pay more so other people could pay less. And what has been the result? For millions of hard-working Americans, higher premiums, long wait times, canceled plans, families losing their doctors. It was a classic top-down, command and control, Washington-imposed solution. They treated patients, real flesh and blood human beings, like auto parts on an assembly line, interchangeable and insignificant. You see it in the way that they wrote the law. Employers don't offer insurance? Make them. Employees won't buy insurance? Force them. They can't afford a plan? Put them on Medicaid. The government doesn't have enough money? Take it from Medicare. If Washington just rearranged the players, if everyone would just fit into their little prearranged slots that we figure out in Washington, everything would work out just fine. Well, it didn't work out just fine. Obamacare is fundamentally flawed. This law is collapsing under its own weight. That's why we had to repeal this law and go with a new approach, which leads me to our plan. If I had to pick one word to me that summed up our plan, it would be quality. We're going to give you the tools you need to get the best care possible. That starts with giving you a choice, putting you in charge. Instead of forcing you to buy a plan that Washington bureaucrats have mass-produced, we're going to repeal those mandates and let you pick a plan that works for you, for your family. We're saying don't force people to buy insurance. Make insurance companies compete for our business. And yes, we're going to help you buy insurance. Most people get insurance from their jobs, and that's great. For many years, we have not taxed their insurance, no matter how expensive it is. The problem is with this open-ended tax break is it encourages businesses to keep buying bigger and bigger benefits. Why not? You're not getting taxed for it. The result? They're pushing up premiums and healthcare costs for everyone else. So we're going to keep the tax exclusion for employer-sponsored health insurance, but we're going to cap it at a reasonable level. That will help keep costs down. And then we're going to use the money we save to offer an individual tax credit. For everyone who doesn't get insurance from their job, and more these days that's the case, we will have more for them. More money for the old and more money for the sick on top of it. That way, more insurance plans will move with the person, not with the job. That's real health security. It's not the 20th century where you have the same job for your entire career, your entire life. You move around, you bounce around. We want to have a 21st century system that's portable with the person. I should point out, there are also real protections in here for the vulnerable and for people who need care the most. Our plan protects people with pre-existing conditions. We let young people stay in their parents' plan until they turn 26. We don't let insurance companies cancel your plan or charge you more just when you get sick. All these things will give people across America peace of mind. At the same time, we're going to make a lot of common sense reforms. Let people buy insurance across state lines. Let small businesses band together to negotiate better insurance deals. Let people use their health savings accounts for more kinds of purchases. Let's do major medical liability reform. And I can't leave it out. We give more states flexibility with Medicaid to design a program that works for their people. And we strengthen Medicare. We save Medicare for future generations by letting seniors pick their preferred plan starting in 2024. So here's how I'd sum up the difference. Obamacare focused on quantity because it put bureaucracy first. Our plan will focus on quality because we put patients first. We think that's the way to go. Let me just say it this way. Either we have the government forcing us and telling us what we have to do, where we have to do it, and how much we have to pay for it, or we put ourselves in charge. We as consumers, as patients, do we want to be the ones driving the healthcare system? Do we want to be the ones where all the providers, insurance companies, nurses, doctors, hospitals, nursing homes compete against each other for our business based on price, based on quality, based on outcomes? That's freedom. That's a patient-centered healthcare system. That's the kind of healthcare system we can and should have. We can have a system in this country where everyone has access to quality health insurance, including people with pre-existing conditions, without a costly, one-size-fits-all, government-mandated, government-run system. If you want to learn more about this, I encourage you to go to our website. It is at better.gop. I want to thank you all for coming here, and I want to thank all of our chairmen and our healthcare task force. Years of work has been put into this. This is our consensus for a better way forward to have a healthcare system we can all be proud of. And with that, I'd like to introduce our Majority Whip, Steve Scalise. Thank you.
Well, thank you, Paul. There is nothing like bold conservative ideas to fill a room. And we're bringing you one today. There is a better way to deliver health care in America. And I think most people recognize now that Obamacare just doesn't work for families. I think one of the most, well-told misdeeds in American politics was that statement by Barack Obama that if you like what you have, you can keep it. How many times did we hear that? It was one of his main tools to sell Obamacare. Of course, today, when you fast forward, over 5 million Americans have lost the health care that they had and liked because Obamacare's mandates, taxes, all of the unworkable components of that law have crushed the dreams of so many people, have taken away the good health care of so many people, and have jacked up the cost of health care for so many people. In my state of Louisiana alone, next year, families are facing a 30% increase in their health care premiums. 30% increase because of the unworkable mandates in Obamacare. The good news is that there is a better way. And that's what we're here to talk about today. When you look at the components of this plan, the whole idea is to flip Obamacare around on its head. The whole idea of Obamacare was to put government in charge of these decisions. And what we're saying is, let's restore the patient-doctor relationship that is so vitally important to healthcare. And we do it in a number of ways. Obviously, you have to start with repeal of Obamacare. But for so long, our members, our chairman that you're going to be hearing from today, have made it clear it's not enough to be against Obamacare. It's a critically important first step to repeal Obamacare. But then you have to follow it up with a true replacement, a plan that puts patients and doctors back in charge of those medical decisions and takes unelected bureaucrats in Washington out of that mix. And you look at the power of some of these ideas, which people have been hungering for years. Ideas like letting people buy insurance across state lines like they buy every other product. People know how to shop online really well. I know when I was working with Dr. Rowe, when we decided at the Republican Study Committee when I was chairman 3 years ago that we were going to come up with a full alternative, we started with the idea of doing just that, putting patients back in charge. And Phil Rowe used to say, you know, people will cross 4 lines of interstate traffic to go buy gas 3 cents a gallon cheaper. They know how to shop well, and yet they're not able to do that for health care. Why not empower people to make those kind of decisions on their own? Remove these barriers that make it harder to have competitive pricing so that not only will you know what the prices are, but you can actually go get the best deal for your family without some elitist bureaucrat in Washington telling you can't have what you know is best for you and your family. Of course, we do common sense medical liability reform. Every month, millions of people have to go and get tests run, not because it's what's in the best interest of their health, but it's because their doctor's afraid of frivolous lawsuits. Not only does it take so much time away from people, but it adds millions and billions of dollars to the cost of health care. So we finally confront those challenges. And again, by putting patients back in charge, the power of those ideas to lower costs, increase the quality, and then just let people know that they're going to be able to make their decisions without worrying about a pre-existing condition being used to discriminate against you. We address that. But then we go further and say that those safety nets, like Medicare, which is headed for bankruptcy right now, we actually reverse that. We strengthen Medicare and protect it not only for current seniors, but for future generations. There is a better way. I'm proud to be a part of this rollout. I'm really proud of the work that our whole conference has done. Our chairmen are going to be the embodiments of those details. But this is something that our entire Republican majority has embraced, the idea that we're not just against Obamacare, but we want to show the American people that there is a better way to put them back in charge of their health care decisions and focus on improving quality and lowering costs. So I appreciate Arthur Brooks and American Enterprise Institute for what they're doing to help us to present this idea to the American people. Let's go and show what America, a better way really looks like. Thank you, Arthur.
Good afternoon, everyone. My name is Jim Capretta. I'm a visiting fellow here at AEI, and it is my distinct pleasure to serve as the moderator of this panel today. As the speaker indicated and Mr. Scalise indicated, several months ago the speaker asked these 4 chairmen with primary jurisdiction over healthcare policy to co-chair a task force on reforming healthcare in the United States. I won't ask them how difficult those conversations were, but I'm sure there was a lot of give and take. We are very pleased that we have all of them here today to discuss what's in their plan. We'll proceed as follows. We'll give each of the 4 chairmen a few minutes to cover some of the most pertinent points of the plan they are releasing today. After their presentations, I will ask them a few questions and ask them for further elaboration on what's in the plan. And then we will turn to the audience at the end of our event today for a few questions before we conclude. We'll go in the order of the dais here, starting with Congressman Tom Price. I'll introduce each of them now, and then we'll just call on them individually. Congressman Price is the chairman of the Budget Committee He represents Georgia's 6th Congressional District, and he was first elected in 2004. Representative John Klein will be next. He's the chairman of the Education and Workforce Committee. He represents Minnesota's 2nd Congressional District, and he's been serving in Congress since his election in 2002. Then we have Chairman Fred Upton. He's chairman of the Committee on Energy and Commerce. He represents Michigan's 6th Congressional District, and he was first elected in 1986. And then finally, we have Representative Kevin Brady, who's the chairman of the Ways and Means Committee. He's from Texas's 8th Congressional District, and he was first elected in 1996. Congressman Price.
Thanks, Jim, and thanks to all of you for joining us today. This really is an exciting day where we finally put to rest the notion that Republicans don't have a health care plan. In fact, we've had literally hundreds of them out there. The problem is when you have hundreds of plans, you don't have one. So I want to commend my colleagues and my fellow chairman for the work that's been done to pull this all together. I want to thank the leadership and the speaker for corralling the will to make this happen and move us in this direction of a better way for a confident America in the area of health care. We're proposing a patient-centered solution, where patients and families and doctors are making medical decisions and not Washington, D.C. The current path that we're on has the majority of Americans unsettled, if not outright opposed to the path that we're on. And I think it's important for us to ask the question, why? Why is it that the majority of Americans don't like the path that we're on as it relates to health care? And I would suggest to you it's because it violates all of the principles that all of us hold dear when it comes to health care. We want a system that's accessible for everybody. We want a system that's affordable for everybody. We want a system that's of the highest quality. And we want a system that provides choices for the American people, for patients. And in fact, the path that we're on right now violates those principles. So what we have put together is a patient-centered plan that respects those principles, that allows everybody to have access to health coverage, but coverage that they want, not that the government forces them to buy, to solve the insurance challenges of portability and pre-existing, and to save hundreds of billions of dollars. A few specific examples I'd like to share with you. The individual and small group market, those of you who recognize or are in that arena, you appreciate that it's been destroyed. And so we want to reconstitute that market and make it so that it's responsive to patients and allow them to purchase the kind of coverage that they want, not that the government forces them to buy. Second, we waste hundreds of billions of dollars. The whip mentioned this, Mr. Scalise mentioned this, hundreds of billions of dollars wasted due to lawsuit abuse in this country, the practice of defensive medicine. And instead of just putting a Band-Aid on it, we propose a bold and robust solution that would allow physicians to, through practice guidelines, to basically have a safe harbor. If your doctor does the right thing for a given diagnosis or a given set of symptoms, then they ought to be able to use that as an affirmative defense in a court of law. And that's the kind of proposal that we put forward. And third, in addition, a healthcare system that works for patients is one that must respect the physician-patient relationship. And so what we do is incentivize the highest quality of care without bureaucratic intervention. This better way, this plan right here, puts forward common sense, positive solutions for Medicare, for Medicaid, and for the larger healthcare arena, so that we respect the principles of accessibility, of affordability, of quality, and of choices. And I'm so pleased to join my colleagues here to present this today and excited about the opportunity to move it forward. Thank you, Jim.
Thank you. Representative Klein.
Thank you, Jim. Following up on Tom's comments, we've been working on this, not only in the Education and Workforce Committee, but all these committees and throughout the Republican conference, where I think the speaker said for 6 years since we got Obamacare, looking at alternatives. And we have come up with hundreds. I think we count the number of bills we looked at as something like 400 different approaches and different things to do. What we've got today is a bringing together, a coming together to arrive at one plan. One plan. We can't keep saying we would do this or we would do that. Now we're saying we're going to do this. And I think it's a very significant change. One thing we've all agreed on all along was that Obamacare was wreaking havoc on working families and small businesses and large businesses for that matter. It's driving up cost. We've seen that for employers, employees, families, depressing hours and wages for low-income workers, making it harder for individuals to access the care that they need. It's also placing a significant strain on colleges, universities, and K-12 schools. Just a a few years ago, Kathleen Sebelius, who was then the Secretary of Health and Human Service, referred to the challenges which we were raising stemming from Obamacare as speculation. And I think now we can agree we're past the speculation point. We see the facts on the ground. The administration's unwillingness to accept the reality of what this law is inflicted on Americans is truly amazing. So the Education and Workforce Committee, somebody asked me one time, one of my colleagues, so why you guys even care? You know, that's Ways and Means and it's Energy and Commerce. Well, there's 155 million Americans who get their insurance through through their jobs, through their workplace. And a lot of that is protected by this little bitty piece of legislation called ERISA, which is actually about that big. So we've been involved in this for a long time, trying to do the best we can to make sure people get the health care they deserve. So we're looking at a number of things. Tom mentioned a couple of them. We want to empower small businesses and organizations to come together and get the economy of scale that big businesses have. We're going to do that. We're going to protect the ability of employers to self-insure, which has come under attack lately, and that's an increasingly popular choice if you get the protections that you need to do it. And we want to encourage the use of wellness plans, wildly popular and under attack by this administration. It's incredible. Everybody, it's common sense that if you're doing things to keep you well, to keep you healthy, the law ought to encourage that, allow that to happen. So we've all come together here, working a lot of things. We're looking forward to the discussion, and I will be happy to. I guess I yield back to Jim. I yield back.
Who yields to me? Well, I'm Fred Upton, and I'm delighted to be here, and want to also confess that we spent many hours over the last couple of months looking at literally hundreds of different plans, listening to a lot of ideas by our colleagues, and felt very strongly that we did have to have a replacement plan. We talked about it for the last 6 years. This is it. This has some very basic principles that I think most of us, if not all of us, in our conference can support. Yes, we have some pretty solid ideas that have been around there for a while. Pre-existing conditions, allowing folks to shop across state lines, coverage for young people. Those ideas I don't think anybody has any difficulty with. But we also grasp with some issues of the reality. Medicaid. Medicaid spending is going to almost double, is the predictions, in the next 10 years. So what is it that we can do to help the states with more flexibility so that they don't always have to apply for a waiver and different plans, but allow them to design the plan that works for them the best? So block grants have been on the table for a long time, but so is this thing called a per capita cap, where different segments of the Medicaid population are going to be able to benefit. Elderly, children, working poor, as well as the working folks as well. So allowing that flexibility to come into play, we think is a much better idea and can ultimately reduce the costs, but really allow folks to have the plan that works best for them.
Chairman Brady.
Jim, thank you for having us here today. And I'm pleased we're joined by two of our key members of the Healthcare Task Force, Dr. Burgess and Dr. Bouchon, as we lay this out. You know, by every measure, the Affordable Care Act is hurting more people than it's helping. Folks are having to pay more and more for less and less health care, and they're really struggling. We're absolutely convinced there is a better way. And our approach is a step-by-step approach that takes care of every American at every stage in their life. And it's especially important for those who can't afford health care today, who don't get help through Medicare or Medicaid, or don't have affordable health care at work. And so what we propose is, instead of Obamacare with its 159 federal agencies, commissions, and bureaucracies in between you and your doctor, we propose a health care backpack. A backpack that can travel with you throughout your life, from job to job, state to state, home, to start a business or raise a family, and if it's a backpack and a plan that works for you, into your retirement years as well. And we know in the 21st century what needs to go into that backpack. You need the ability to pick a healthcare plan that's right for you, not what's right for Washington, not an Olympic standard gold, platinum, silver plan, but one that's tailored to your needs at that point in your lifetime, to be able to take that with you. We know that Americans need access to health savings account to make sure that you can pay for the day-to-day and routine costs of medical care. And we also know in the 21st century, Americans need easy access and control of their medical records that they can choose to give to that new doctor or when they enter that new hospital. So they're seeing your whole medical history, and they can treat you more accordingly. The way we do this is to unlock a tax break that now is only available at work. We make it flexible. We allow it to go with you. In effect, we create a monthly portable tax credit that every American for the first time will have the freedom to choose a plan that's right for them. And because we know healthcare lasts your entire lifetime, and we know Medicare is so important, we're proposing significant changes to save Medicare, eliminating the parts of the Affordable Care Act that have hurt Medicare, redesigning it so it fits the seniors' needs more closely, and then offering new options so that seniors can take that backpack into their retirement years as well. In fact, a time of their life when they need those tools more than ever.
Great. Thank you. I have questions for each of you to dive a little deeper into each of these aspects of the plan. But let me start with you, Chairman Brady. It seems to me when I look at the plan that one way to think about this is a very important development on the insurance side, which is that everybody in the United States will either be on, if you're an elderly person or disabled, you're on Medicare. If you're low income, you're on Medicaid. But for the working age people and their families, either you're going to get an employer coverage plan, which most Americans will continue to get under this approach, or if you're not eligible for an employer coverage, you're not offered an employer plan, you get the tax credit. And so is it fair to say, and I think it is, that this plan essentially makes it so that everybody in the United States who wants to have health insurance can get it?
It does, for the very first time. The largest tax break in the tax code is that which you get to help you with health care. But just understand, you only get it if you do exactly what Washington says. You get it through your employer and you buy the plans that they want. We're proposing to unlock that tax break so that all Americans at all stages in their life have the flexibility to buy a plan that's right for them and to be able to take that with them in their stages of life. It's critical for that single mom who wants something better than Medicaid. It's important to that college graduate who's in that first starter job that may not have a very good health or no health care plan permissible. It's important for those workers in between jobs, for those who are moving to another state with a spouse that doesn't, again, have a good quality health care offering for them. It's important, I think, for our startups, people who really want to launch that new American dream, but they've got to have quality health care that fits their needs. It's important to people who retire early. And I would argue, because health care, again, is lifetime, it's really important that Americans have that freedom for the first time ever to take that plan that they need into their retirement years as well. And so this is really about giving healthcare freedom in a way Americans have never experienced, to buy healthcare that fits their needs and not Washington's.
Very good. Chairman Price, my background's in budgeting, so I can't help but ask a question a little bit about fiscal policy. Obviously, this program is not fully specified. I mean, there's some things that you're going to continue to work on in the months ahead and get into further details about. But just in terms of intention and where you want to go with this, I mean, the ACA, the Obamacare, was a massively expensive program. It expanded Medicaid quite a bit. It did have a very large set of premium credits, they call them, for lower income households. And this will move in a different direction in a lot of ways. It would, best as I can tell from the reading of the Medicare and Medicaid section, it's got a lot of reforms in here that potentially could save significant amounts of money over the long run. Do you have a sense of where you want to go with this in a fiscal sense?
Yeah, I think the key, as Kevin mentioned, is that we want to make certain that everybody, and that's key, everybody in the country has an opportunity to gain the coverage that they want, not that Washington forces them to buy. The good news is that if we provide the flexibility and make this truly a patient-centered plan, you can do that in a way that saves money. You can do that in a way that saves money in the Medicare program. We've proven that as we've put on the table and proposed a premium support plan for the last 5 or 6 years, saves money for both the government and for seniors. That's the kind of activity that you get from a fiscal standpoint with flexibility. Chairman Upton mentioned the flexibility that's needed for states. If states have the flexibility in the Medicaid arena, then you actually save money for states, you save money for taxpayers, and you save money for the federal government. And at the same time, you provide greater opportunity for the kind of coverage that the Medicaid recipient wants, the kind of coverage that they want, not, again, that the government forces them to buy. So this is a good news all around if we're able to have the American people recognize that if we move in this direction, you get a greater fiscal return, less foreboding for the American taxpayer, but also, and the best thing is that it is a plan that is responsive to patients. It allows patients to select the coverage that they want, not that Washington forces them to buy.
Very good. Chairman Klein, I want to dive in a little bit more about the employer aspect of this. I mean, many times in the past when people have come forward with plans, people will say you're undermining the employer-based health insurance system. As I think you said earlier, there's 155 million or so Americans, something in that range, workers and their families that are enrolled in employer plans today. What is the intention of this plan with respect to those employer plans? Is it to retain them, to strengthen them, to change them in any way? What's your view on
Well, there are many of the things that we're doing will allow more people to get coverage to their employer. Small businesses, many of them would love to offer health insurance coverage to their employees, and they can't do it. But if you allow them to band together in what we've been calling association health plans for as long as I've been here, that will allow more employers to offer insurance. Some employers would like to be self-insured, but if they can't buy stop-loss insurance, they can't do it. We want to make sure that they can do that. So the intent is not to do away with employer-provided health care, because I'm sure that at the end of this, we could still have a number very similar to what we were talking about, potentially more if you get small businesses the opportunity to provide the health insurance they want. And that's why we put it together the way that we have. It's not to take away or do away with employer-provided health insurance, is to make it actually more available for more people, and we're going to do that by driving down costs.
Chairman Upton, on the regulations with respect to pre-existing conditions and how that will work relative to the Obamacare and the Affordable Care Act, I think we should all recognize, I think you probably do recognize, that some aspects of Obamacare are popular in a certain sense, right? Because they did, people who felt like they were not being treated as well as they should have been under prior insurance rules now feel like at least they can't be charged more based on a sickness or an illness. This plan, as I understand it, tries to retain and promote a regime for doing something similar without Obamacare's sort of massive regulations. Can you give a little bit more about that?
That's right. I mean, it's we all hear those scare stories about folks being denied coverage because of some pre-existing condition, and we believe that by what we have designed here allows people to have continuous coverage and therefore their pre-existing conditions covered. We also believe in risk pools by allowing the states to establish a number of different, having the flexibility to establish a number of different pools that, in fact, people will be able to qualify for if they fall between the cracks and not be able to have some type of coverage that would otherwise be the same as the pre-existing condition that was part of Obamacare or ACA Act. We don't have a problem with that. We think we've designed it in a little better fashion, and in fact, patients will be, or folks will be able to have those choices with those being covered.
Very good. Back to you, Chairman Brady, on HSAs. We didn't have enough time yet to really talk about that. I would note that the legislation that got HSAs really turbocharged was enacted in 2003, and a lot of predictions that they wouldn't work very well. And now we've got huge enrollment in HSAs, and more Americans are in them. What does this plan do to try to take the next step.
Yeah, health savings accounts are really a critical part of a healthcare backpack, what every American needs in the 21st century. They are extremely popular because it's a very affordable way with the tax benefit to save for medical care. The Affordable Care Act took aim at health savings accounts, limiting how Americans could use their accounts, actually punishing businesses for contributing to that local worker in that health savings account. In our plan, we reverse that. We try to expand how you use health savings account. In fact, on the House floor this week, we moved legislation that makes it more flexible, allows spouses to catch up contributions, use it in a broader way, and double the contributions for it. And so we think if you want to give Americans more freedom, more control, in the ability to make health care more affordable for their family, health savings accounts are a critical part of that.
Good. And back to you, Chairman Upton, on states and Medicaid flexibility. When I read the plan, it did give the option to have the per capita payments to the states. Plus, there's the option for some states, if they want to do a block grant if they so choose. And then further, there's a state innovation grant proposal. I'm not sure if that would be in whose jurisdiction that would fall in. Maybe you guys don't know yet either. But anyone who
we'll
might
take jurisdiction, right? I don't know. It's 3-1 against me.
Yeah. But when I look at the entirety of this, it's obviously a big decentralization approach, trying to really bring the states back.
Look, we want the states to be able to design the plan that works for them. Some states may want to have a work requirement for those that are able-bodied. We want them to not have to go to Washington and ask, Mother, may I, but rather decide on their own what they might be able to. Remember this, this started as a 50-50 program a lot of years ago. That has grown dramatically, which is why the cost is on a ramp up that's going to almost double in the next 10 years. We want to change that. Yes, we want savings, but we want the states to design a plan that helps their citizens the best way. And by providing that flexibility, in fact, that can happen.
I'm reminded a little bit of welfare reform in 1996 when we moved toward block grants in that area in your committee, Mr. Brady, and lots of savings were found once the states had a strong incentive to do so. Chairman Price, back to you. Stepping back from, there's lots of detail here and lots of important provisions, but I think the big picture is still the important point here, which is that it seems to me that the plan is trying to move decisively in the direction of moving control over decision-making out of the federal sphere in a lot of ways. During these years, we've had IPAB, which may become a reality pretty soon, the Centers for Medicare and Medicaid Innovation, the decisions about the benefit package at the federal level, frankly, federal regulation of health insurance. Most of the rules now are coming from the federal government. If you just look at the pronouncements that are coming out of HHS, it's pretty much daily in terms of things that affect the system. And it seems to me that what's going on here is you're trying to say, let's move the power and decision-making elsewhere. What could Americans expect to happen to the quality of their care? How would that kind of move really improve the outlook for them?
Well, it's a fundamental philosophical difference that we have with the other side, as the speaker mentioned. They believe that government ought to be in control of health care. We believe that patients and families ought to be in control of health care. And sadly, what we're seeing right now is that government control that we've seen ramped up over the past 6 or 7 years has resulted in a decrease in quality that's being seen by patients. People have coverage, but they don't have care. They're priced out of the market. The premiums are higher than they ever could have imagined. The deductibles are such that if they're told by their doctor that they ought to get this procedure or that procedure or have this examination or that test, many folks can't afford it at all. So they have the coverage, they've got the insurance card, but they don't have the care. That's a decrease in the quality of care that's being provided out there. There's an article in Health Affairs this month that talks to the quality of health care being diminished in our nation right now. And sadly, we believe that is fundamentally a byproduct of the intervention of the federal government. So how do you improve the quality of care? You make certain that you allow for the innovation, you incentivize innovation, decision, and you make certain that every single person is able to have the coverage that they want, not that the government forces them to buy, and you move those decision-making processes back to patients and families and doctors, not the federal government.
Good. Well, we have a few minutes here in our program before we conclude, and so we now have some opportunity for questions from those who are here in the audience. I'll call on you, and then please make your question very brief. State your name, any professional affiliation, and whatever you have to say, please make it in the form of a question. And so why don't we, I guess we'll start here, and then we'll go that way.
Hello. Hi. My name is Mavis Britcham, and I am a fellow with the Friends Committee on National Legislation. And sitting here, I'm very impressed by everything that I'm hearing so far. And Speaker Ryan, the beginning of the month, he reported his poverty release, along with this, A Better Way. And we know that poverty and health are inextricably linked in this country. And it's just a general question, but as a citizen of the United States, I'm kind of concerned that poverty and health are not partisan issues. It affects all kinds of people. So is there a way that we can address healthcare with a bipartisan solution where we're bringing both Republicans and Democrats to the table to address this very huge, broad issue? Thank you.
Good question.
You know, that is a great question. And I'd like to think we knew for a long time that we had problems with our healthcare system. One of the big issues on Obamacare was that it was a pure Democrat bill. Not a single Republican amendment was allowed to be offered on the House floor when it was debated. And when it went to conference, they forgot the House bill altogether because of the change in the Senate, and they just accepted the Senate bill. We tried in our committee, and I know these guys did too as well, to offer Republican substitutes, Republican amendments, things that would make it stronger. None of them survived, not a single one. We want to, and now we are 6 years later, and we see enormous problems. States like Arizona, they're talking about a 65% increase in their premium. A lot of states have dropped their co-ops, things that they thought might work and provide more competition. It's not happening. So I'd like to think that our proposal that we're unveiling today, in fact, will be able to attract a number of Democrats to be with us as we move forward to correct many of the flaws that a lot of us said were going to happen and did to help the American worker. They don't want a partisan effort here. They want a bipartisan effort to fix it, and that's what this plan begins to start.
Anybody else? Yeah. Yes, I guess we'll go here.
Hi, my name is Barbara Dello, and I'm a nurse. Thank you for being here, and I'm glad to hear your words. As a nurse and a family member, I've often taken care of and advocated for frail and elderly, and I can tell you they are in trouble. Their families are exhausted, the patients are scared, and the nurses are on the computers, and the patients don't get taken to the bathroom, which is awful. When I talk about it, and
Do you have a
I do
quickly
have a
with
question.
a question?
Yeah, I'm
quickly
gonna
to the question,
yeah.
please.
Okay. What they say is to me is that long-term patients use a disproportionate amount of the healthcare dollars. But isn't that how insurance should work? Shouldn't sick people get most of the healthcare dollars? Will you make sure that human lives do not become secondary to economic calculations? So that's the question. And that excessive healthcare dollars will not be diverted from patients into bureaucracy
Who wants to take that
and
one?
stuff like that.
I mean, this is exactly why we put forward this plan, because we believe that the money ought to get to the patient, not be utilized to incentivize the nurses and the doctors to check the boxes and make certain that they're doing what Washington wants them to do, as opposed to what the patient needs. What you outline is exactly what's happening in hospital rooms all across this country, and in operating rooms, and in clinic rooms, and in doctors' offices, and it is ignoring the patient needs, and it's only happening because of what the rules that Washington has put in place. So what we proposed and will push endlessly for is to make certain that what the patients and what the physicians and the nurses are able to do is to respond to the patient needs, not Washington needs.
I think we have a question right back there. Yes. Then we'll come to you.
Hi, my name is Anjali Batla, and I'm currently a Global Health Policy Intern for CSIS. I had a question because I read today that one of the components of this plan is that it would allow states to implement workplace requirements for individuals to enroll in Medicaid. And I was wondering what your response is to concerns that this may prevent individuals that are between jobs or some of the most needy individuals from accessing health care.
Chairman Upton?
Well, we allow the states to manage that. They would have to pass through it, I would imagine, through their legislature. But if folks are able-bodied, I mean, we have a lot of folks on welfare that report and actually make application for jobs. In some states, it's literally every day they're required to do that. So you'd allow the states to have that as an option and for them to manage the program.
I would just-
Or get into training, or get into job training.
Exactly. I was just going to say that through TANF, the cash welfare reform that was enacted in 1996, it was a work requirement, but with provision to allow states to move people into either training or work or sort of on the path toward work. And so something similar, of course, depending on the state, could perhaps be considered in Medicaid.
This is a really important question, though, but we don't have to guess if it works. If you look at Kansas, you look at Maine, two states right now that have enacted programs that positively affect people's lives because they are offering individuals the opportunity to work in exchange for benefits. And they're lifting people up and out of poverty as opposed to imprisoning them in poverty. So it's very exciting. If we look at the places where it's been tried, it's worked incredibly well.
Good. I think we have a question in the back here, Robert.
Yeah, thank you. I'm Robert Book of HSI. One of the problems that comes up with all these health reform, with Obamacare, with the Massachusetts plan before that, was adverse selection, where you get sick people signing up and healthy people not signing up, which of course increases the premiums for those who enroll and makes it very difficult for other people to enroll. I want to know what in this plan prevents adverse selection from driving premiums up so that ordinary people have trouble accessing insurance.
If I may, there are two great incentives in this approach. One, because we're covering pre-existing illnesses, and as long as people make good faith efforts to keep continuous coverage, when they get sick with that cancer, that very costly illness, they're guaranteed to be covered at those reasonable prices. That is a huge guarantee for the American public. But I would tell you this as well. We've got this spiral going on in the Affordable Care Act. Sicker and sicker people signing up, fewer and fewer healthy signing up. It's really going the wrong direction. Think about this. 2 out of 3 Americans who are eligible for subsidies in Obamacare have found a way not to be in it, either through exceptions or they simply will pay the IRS rather than being forced into a plan they don't want. We think with the freedom to buy a plan that's tailored to you, that's more affordable because it doesn't have all those regulations and directives and mandates, we think a number of those Americans are going to take a fresh look at a new way of delivering health care. So I would predict a number of those people are going to be very interested in a plan like ours, that health care backpack directed toward them. And I wouldn't be surprised if you see coverage numbers increase on an approach like ours.
That's right.
If I may just add to that, moderator's prerogative, that the plan, as I understand it, also, I think a big issue in the ACA is that it has this 3-to-1 ban, that you can't charge consumers in the individual market any more than 3 times the premium you charge to the youngest enrollees. That act turns out to be a very constraining requirement and has priced a lot of people, frankly, out of that marketplace and made it a very unattractive product for a large number of Americans. So I think the plan that they are putting forward here today would leave that entirely up to the states. There'd be a default at 5-to-1, but states could even vary it from around that depending on the preferences of their citizens. So some of the, there's a lot been talk about, Washington imposing certain requirements on things. That's one that's had obviously very real consequences. And I think it's a primary reason why there's instability in the premium structure right now in the exchanges. We are just about out of time. Anyone with the last word?
Well, may I just very quickly, when you talk health care, Medicare is not the 800-pound gorilla in the room, it's the 8,000-pound gorilla. It's so important a program, but it's in shaky financial shape, and the new report says it's getting even more insolvent as we sit here. And so Republicans are determined to save Medicare for the long term, and we start in this legislation. First, we eliminate the parts of Obamacare that actually hurt Medicare, including that independent payment advisory board. We invest instead in programs we know work, like Medicare Advantage. We want to redesign Medicare, which is extremely complicated for seniors, into a simpler approach with one copay and deductible, something that actually works for seniors rather than against them. And finally, because we think you shouldn't have to drop your backpack at the front door when you enter Medicare. You ought to be able to take that plan you want, those medical records you need, and the health savings account to help you pay for it into your retirement years as well. So we propose giving Americans that option. They can keep in traditional Medicare, but an option to really drive a plan, take a plan that's right for them, we think is critical of the solvency of Medicare for the long term.
That's the final word. Thank you very much.
Thanks, Jim.
Good work.
Great job.
So did you guys, how'd you guys figure out?